Ford. I'm imagining Dr. Puente probably already told you guys, but I'm a board-certified clinical psychologist and a lieutenant commander in the Navy. Right now I'm doing a 2-year fellowship with him in neuropsychology. I'm re-specializing, so through the Navy they're allowing me the opportunity to work with him and then go back to the Navy and do neuropsychology. So because this is the history of psychology course, I thought what I would do is highlight just a couple of kind of some of the areas I find most interesting of how military psychology has contributed kind of in the history of psychology in general. Hopefully some stuff that you guys are not aware of, because military psychology has actually contributed quite a bit to kind of where we are in psychology these days. So I kind of just cherry picked out some of the areas I thought were most interesting. We're definitely just kind of barely scratching the surface of what's out there. So definitely don't take this as an all-inclusive list. And focusing mostly on what's happened in the U.S., so kind of war by war of the U.S. wars, but obviously this has happened throughout the world in military psychology throughout Europe and other places of the world as conflicts have arisen as well. And because I'm in the Navy, it has a little bit of a Navy bent, so I'm a little biased towards the Navy, obviously. Feel free to ask questions throughout if you have them, or at the end, either way. So starting with the Civil War, right, so mid-1800s, not too much kind of psychology specific came out of the Civil War, but why I'm starting there is because that's some of the first kind of indications we have of some of the interest in military-specific psychology. So we have some of the kind of first documentation of psychological symptoms, which I called nostalgia, soldier's heart, war neuroses, lots of names they had for that, which we kind of believe are kind of present-day post-traumatic stress symptoms. Because of this, and because there was, it was a not totally voluntary force at the time, there was also kind of the first concern about malingering and how people might use medical or psychological issues to get out of serving in the war. So this is what we see documented as some of the concern of not only psychological symptoms, and they were not written of in a positive way or in a therapeutic way. It was more seen as kind of moral weakness or kind of characterological weakness at the time, that people would have some sort of psychological response to war, and then how people might use that to in fact just get out of the war. So not entirely positive, but it kind of lays the foundation for what we see as kind of a more positive direction later on in the world wars. In addition, we have the establishment of St. Elizabeth's Hospital, which is one of the first psychiatric hospitals up in D.C. It was actually primarily for soldiers at the time. And why this is important is because it also became a big hub for research and training of psychiatrists and psychologists. And one of the things that came out of that was the first published protocol using assessment to kind of look at how we might select more successfully for the military. So kind of some of the first standardized testing looking at selection, and again looking at how we might weed out those folks who are weak, who might have issues when they go to war. So that was kind of how they were looking at it, and that's why the interest kind of peaked. So that's kind of some of the stuff that came out of the Civil War. Now fast forward 50 years or so to the First World War, and kind of big boom, lots of growth, and definitely headed in a more positive direction. So one of the more interesting things I kind of saw coming out of World War I, so Robert Yerkes, are you guys familiar with who he is? If you guys heard of the Yerkes-Dodson principle? Yeah, so that's Yerkes of Yerkes-Dodson, so looking at the relationship of arousal and performance, which is actually a really important principle in military psychology. We talk about that a lot. And Edward Titchener, yeah, so he's obviously a big name, father of structuralism, major figure in experimental psychology. So Robert Yerkes at the time was the president of APA, and basically what he said was, hey, we should, as psychologists, we should be giving our expertise to kind of support the mission of the nation, right? So this patriotic, hey, we should be giving kind of everything we know to help the country. So he proposed to APA to set up committees to have all the psychologists kind of look at what their area of expertise were and how they could support the military and what they were doing in World War I. So Yerkes and Titchener in particular, because they were kind of in the assessment kind of research realm, they really looked at kind of formalized testing and building on kind of that start from the Civil War. They looked to take that further with intelligence testing and how that might be helpful in screening service members. So they took the Stanford-Binet, which already at that point had been kind of tested and normed on a pretty large group of people. They then developed the Army Alpha and later Beta tests, which were they were able to mass test like almost 2 million service members. So they had a huge population they were able to test on, and to kind of start doing some research in intelligence testing and selection for the military. This is incredibly important for psychology, because that later kind of formed the basis for the Wechsler tests and the WAIS, which, as you guys probably know, is the gold standard for IQ testing now. So this kind of laid the foundation for that. They also did some really early personality testing, which also was the foundation for a lot of the personality testing we use now, including the MMPI, which is, again, one of those gold standard tests. So obviously really important stuff coming out of kind of the testing and some of the first kind of formalized testing. We also see the birth of neurosurgery. So you've got people being trained in neurosurgery, which means more people are surviving head injuries. They're understanding more about how the brain, kind of the physical brain works. And then they start looking at treatment for traumatic brain injury and some of the kind of most early cognitive rehabilitation efforts that we see, which again, laying the foundation for where we are now. This was also kind of well before really a lot of the clinical psychology had been developed, and well before cognitive therapy, which is now kind of the primary kind of method of therapy. But we see kind of evidence of use of cognitive therapy before it was even a real thing, to treat shell shock, which again is kind of what they called, what we believe is post-traumatic stress. So again, kind of starting to look at kind of that therapeutic role, starting to kind of see that instead of this being a weakness, right, this is probably just a natural response to a really terrible situation of being in war, and this is something we should treat versus kind of see as a weakness and kind of try to weed out. They also established what they called the morale division in the military, and it essentially is what it sounds like, is them looking at ways to improve morale, to understand what motivates service members to serve, how to build kind of resilience without using that term. And so again, this is kind of the first time that they were really looking at the role of emotions, the role of mental health and kind of positive health in understanding how people perform and kind of getting service members to more successfully serve in very arduous, stressful situations. So fast forward again, World War II. Lots came out of World War I, everything we just talked about, but World War II was really kind of the time when psychology took off. And there's quotes kind of saying that psychology was probably one of the most influential factors in us kind of winning the war, being as successful in the war as we were, for all the things that were developed at that time. So one of the most interesting things, which I had never read about before prior to kind of doing some research for this. So are you guys familiar with B.F. Skinner? Mm-hmm. Yeah, okay. So he actually trained pigeons in World War II to guide missiles. So he basically used kind of his research he was doing on training animals, and he kind of conditioned them to respond to help them guide the missiles. And this was a really big issue. This was well before we had any kind of electronic guidance systems, obviously. And they were basically just shooting off missiles blindly and hopefully killing some of the enemy and probably taking out a lot of innocent folks as well. So the military was obviously very interested in being a little more effective with, particularly as the use of missiles was increasing. So they never ended up being used, and some say the military kind of put a stop to it because they were skeptical about whether or not it would actually work, and then others say that Skinner didn't want his pigeons to be murdered because basically it was a suicide mission for the pigeons. But why this is important is it kind of laid the groundwork for kind of what we have now as far as kind of educational software, program testing, so kind of understanding how things are learned and more successfully teaching humans, right? And a lot of Skinner's work came out of that, and some would argue that his work with the military laid the foundation for then his subsequent research, and obviously he's an important, influential figure in psychology. In this war, they also continued to build on testing. intelligence testing as well as aptitude testing, and this is kind of where we see them start to really kind of hone in on how can we better select people for certain jobs, right? So instead of just kind of blanket, are you good for the military, right? Okay, you're in the military now, and then can we better fit people based off of their aptitudes or their strengths and weaknesses into kind of niche positions. And this was particularly important in the aviation community and continues to be, and has kind of led to them kind of generating certain aptitude and personality profiles for aviators that kind of the folks they know who are more likely to be successful, and this has been hugely influential in civilian aviation as well. So not only kind of better selecting individuals to do those jobs, which obviously are very important and have a lot of implications for safety and everything, but also starting to look at things like the environment, ergonomics, so kind of the idea of fitting the machine to the man, to enhance performance as well. So not just looking at what's the aptitude of the human kind of flying the plane, but also is the plane set up in a way that's going to help the man most successfully perform, right? And again, this is still in use today, greatly in part by a lot of the continued efforts of military aviation in conjunction with civilian aviation. And then two more kind of wars that kind of bleed into each other, right? Korean War, we don't talk too much about. It was a short one. It was kind of a blip in between World War II and Vietnam. But a couple of kind of interesting things that came out of that in and of itself. So the Korean War, we see a huge increase in psychological warfare. This had been previously used, but there was a huge resurgence in the Korean War. And this is where they're using psychologists to help them know kind of how best to fight against the enemy. The Korean War was very different than from previous wars. And they argue that psychological warfare kind of helped them kind of turn hundreds of thousands of Koreans kind of towards the American mission and away from kind of supporting the Korean mission. So one would argue pretty influential in that war. This is also the war we saw a big increase in prisoners of war. And this was the first war that the American public was kind of real-time aware of what was happening, right? Because as we get into the age of radio and the early ages of television, psychologists started studying kind of what was the impact not only of prisoners of war and how do they reacclimate into society, but also of the public at large being more aware of the atrocities of war, more in real time, having it kind of be more at their doorstep than any previous war. So our understanding of resilience in stressful situations, which obviously kind of weighs into a lot of what we know now about even natural disasters, psychological first aid, things law enforcement use, the federal government, FBI, things like that, to support individuals, not only folks who are involved in conflicts, but the individuals who are impacted by them. And then Vietnam War, which basically just started right after the Korean War and went on for like 20 years. This was the first truly televised war, so obviously that was a really big focus for psychology, is the impact of that. We also see out of the Vietnam War a very drastic increase in substance abuse issues, and through the VA, a lot of the early research and evidence-based treatment for substance abuse. And while the formalized diagnosis of PTSD doesn't come till later, a lot of it was based off of the Vietnam veterans and studies with them, and seeing kind of the ongoing effects once they returned home. So Vietnam War was a huge turning point for clinical psychology, in particular in the military. This is where we see a huge increase in actual uniformed psychologists helping to treat this stuff, recognizing mental illness. This really the start of the VA system and the disability system and access to ongoing care for service members, right? All kind of in line with what's happening in kind of the civilian side of psychology. And then modern, I just kind of lumped the 1980s to the present. Military psychology continues to be a large source of research in lots of different areas, both active duty and on the veteran side. I just kind of listed some of the ones I think are kind of particularly influential. So looking at the response of stress, the kind of body and brain's reaction to trauma, and really looking at some of those biomarkers of trauma and stress, looking specifically at the brain and how it's influenced by trauma, right? Things that they're using service members obviously to understand more effectively, because you've got a large population of people routinely being traumatized, unfortunately. A ton of the research of what we know about sleep, sleep and performance, cognitive performance, physical performance, a lot of that research has come out of looking at military members who've been up for days at a time or put in high stress situations while sleep deprived. And a lot of policy has come out of that as far as work shifts and kind of understanding when people reach that impaired level on this kind of sleep trajectory. The research, a lot of the research on evidence-based psychotherapy has been kind of hugely in part kind of alongside military and VA. The military and the VA are kind of some of the biggest proponents of psychologists and social workers and mental health providers providing evidence-based treatment and actually monitoring that, and so again really enhancing the quality of the field of psychology when it comes to kind of the clinical side. Obviously addiction, and it's a huge issue in the military, and a lot of our understanding and the treatments have come out of that. Disability assessment, so a lot of what we've learned from the military side is translated kind of into the civil side with kind of workers' comp and things like that. Suicide, unfortunately, is just a huge issue in the military and veteran population, but on the good side has spurred a lot of really good research that's hopefully moving us in the right direction. Traumatic brain injury, neuropsych, kind of looking at, again, even well before what we see now with the sports concussions, right? Before that was the military population, and especially with our most recent conflicts, because everybody essentially came out of that with some sort of mild traumatic brain injury and new sorts of traumatic brain injury like blast wave injuries and things that really hadn't been looked at before. And on a positive note, a ton of stuff is coming out of the military looking at kind of on the positive psychology side, looking at the idea of resilience, preventative, how do we help people build resilience before they go into potentially traumatic or stressful situations so that the outcome will be better on the back end. And again, because we have a population that we have and we know they're going to be traumatized or put into some sort of stress, right? It's an easy population to develop those things on because we've got them beforehand and we know we're going to put them in a situation and we get to see kind of how they do on the back end. So again, military psychology right alongside the rest of psychology has kind of been there helping hopefully to spur lots of new research, clinical interventions, and on a population that in lots of ways is kind of highly representative of the American population. So you've got this very diverse group of people that you get to kind of generalize some of this out, and hopefully it does generalize. Let's see where we are in time. So I wanted to end just with talking a little bit about kind of life as a Navy psychologist, specifically kind of in the modern Navy. And I wanted to just, I guess, kind of educate on all of the different things a Navy psychologist might do. So I'm a clinical psychologist, obviously. And in the clinical side, we have child psychologists, we have neuropsychologists, operational psychologists, and prescribing psychologists. The military was actually the first place that they kind of tested out and looked at can a psychologist prescribe medications safely and effectively, and it's now I think up to 5 states as well as Puerto Rico, where psychologists can legally prescribe meds as well. Lots of rural areas, the only prescriber you might have is a prescribing psychologist, so it's definitely kind of filling a niche that otherwise people would have no access to that. And then outside of the clinical side, we have research psychologists who are just doing the research on all the stuff that we talked about. And then aerospace experimental psychologists who really are just looking at kind of the aviation piece of it, so building on everything we just talked about that started in World War I. I'm really just so I don't know as much about the other two. Obviously, I interact with them, but I'm going to focus primarily on what a clinical psychologist can do in the Navy. And it's very diverse, and it's a cool opportunity as a psychologist because while some of the times I'm just cranking out patients, sitting in an office, there's lots of other opportunities that you wouldn't otherwise get if you weren't wearing a uniform in the military. So I kind of broke them down by some of the labels we get, and this will kind of highlight the military and the Navy has its own culture, right? That's kind of somewhat different from the culture at large, but then it has lots of different subcultures based off of the different communities within the Navy. And some of the nicknames that we have for psychologists in the Navy will kind of highlight some of the unique kind of cultures that we deal with as we shift between these communities. So you can be a psychologist that just happens to wear a uniform, and most of the time that's how I feel, right? I go into a hospital, I go into a clinic, and I just see patients just like a civilian psychologist would. I just happen to be wearing a uniform and have a rank title that people call me, and I can give people orders. But outside that, I'm just really a psychologist. It's a 9-to-5 job, go home at the end of the day, go home on the weekends. Pretty good gig, get paid pretty well to do that. Then we have the psychos, right, which is a funny title, but those are the psychologists who are stationed on the aircraft carriers. And why they're called the psychos, it's not actually a derogatory term, it's the psychology officer for the ship. So they have one psychologist on an aircraft carrier, and on an aircraft carrier there's about 5,000, give or take, service members. So you have one mental health provider taking care of a population of 5,000. So it's like one psychologist in a small town, basically. But the small town is super stressed out and everybody wants to go talk to the psychologist, so that's the difference. So you belong to the aircraft carrier, you deploy with them, so they go out for 6 to 9 months at a time, and the psychologist goes out with them, lives on board with all their patients, and is a part of that command. The downside, right, you have patients who are just coming up to you all the time, like you'll be in the galley eating, which is the cafeteria, and a patient will want to come talk to you, right? There's no boundaries, there's lots of dual relationships, right? The guy you're seeing might also be the cook on board or might also work for you, right? So lots of conflict and no boundaries. The upside is that you get embedded, you know the culture, you're going through the stress with them, you can be more effective. We also do a lot of consulting for the commands. We do a lot of kind of industrial organizational psychology as well. So environmental interventions, making recommendations, hey, I'm seeing a trend here, this department is very stressed out, everyone's not doing well, you probably should intervene and maybe do something different and give them some suggestions. So the cool thing is that you get to try to kind of get on the front end and keep some of the problems from developing downstream. Then we have the wizard. Anytime we work with the Marines, right, they call us the wizard. It initially started as a derogatory thing, so they would say a Marine goes to the wizard and the wizard makes them disappear, and which meaning you go there to get out of doing your job and then you never come back to the unit. So that's the Marine culture, or at least that initially was the Marine culture. We've worked for years and years, decades at this point, to try to undo some of that stigma and kind of some of the idea that all we're good for is getting people out of their jobs. And now they still call us the wizard, especially the infantry Marines, who are the ones that just kill people. That's the infantry. But it's kind of a positive pet name at this point. So instead of us being the one who makes people disappear, instead we're the ones that you go to and you magically get fixed, right, like a wizard. So that will probably never go away, and again, it's mostly a positive thing at this point. One of our newest ones is Sad Penguin Whisperer, which is, again, not a positive thing. So our most recent endeavor is to have embedded providers with the submarine fleet. The submarines culturally have been very resistant to mental health. And so where this comes in, they see anybody who has mental health problems, they call them sad penguins, and they kind of derogatorily say if you go to mental health or you go to medical, you're tapping out, meaning you're quitting, because submarines are incredibly stressful and it's very hard. It's probably the hardest thing I've encountered in the military, just seeing kind of the different communities. So we've worked very hard to try to undo some of that. It's only been a year at this point. I was actually the first embedded psychologist with the West Coast submarine fleet, and I was in charge of over 25 different submarine commands that you have to monitor, which means 25 different commanding officers who have different viewpoints, 25 different crews who have different thoughts and feelings about things, and it's a lot of trying to educate from the top down, right? So part of it is managing the patients who are having issues, but most of it is trying to undo some of that stigma and showing them that in fact we can help people get better, we can help people handle the stress more effectively, and keep them doing their job instead of them seeing it as a means for people to quit. And then again, so I mentioned a lot of IO consultation in the military, which is interesting, gets you out of kind of just seeing patients, and hopefully is us getting ahead of the problem and kind of is that preventative approach. We get to do humanitarian work, so psychologists go out on all the hospital ships that go do humanitarian missions throughout the world. And so you get to go to other countries and help educate their medical professionals on how to treat mental health issues. You get to actually kind of work with the individuals there and help, and a lot of times this is after natural disasters, things that their lives have just been totally ripped apart, and we get to go do positive things in those other countries. So that's a really kind of cool and unique thing we get to do as well. We have psychologists at the highest levels of the Navy making policy. We have somebody who works specifically on suicide policy, suicide prevention efforts, making decisions about how our mental health programs are run, how the Navy at large is run to help mitigate some of the kind of unnecessary stress that leads to these problems, right? So we get to be kind of at that top level, hopefully making a more systemic kind of positive change. And we have psychologists who have been commanding officers and executive officers, which is also kind of a cool part of the military. So they get to step outside of their clinical job and be just in charge of sailors and running hospitals and clinics, and which, if you think about it, is interesting because when you become a psychologist, you don't learn anything about running a hospital, right? So that's kind of a cool way that we get to, again, kind of institute systemic change. And I think that psychologists are well suited for positions like that because of our skill set. We've got good people skills. We know how to work well, typically with individuals, diversity of individuals, practice kind of assertive communication, things like that, manage conflict. So I think overall the Navy has seen that psychologists are very successful in those positions. And then underneath everything, kind of a really interesting piece of the clinical psychology is that we're always monitoring what we call fitness for duty. So can this person do their job? Anytime they come and see me, I am one part a clinician treating their issue, and I'm one part a Navy officer trying to determine if they're safe to do their job. And that's a really interesting competing demand that does not always kind of mesh very well together. And sometimes you're on the same page with the patient, and sometimes you're on the side of the command and having to somehow help the patient understand that while still maintaining a therapeutic relationship and working kind of therapeutically with them. And that's just kind of a constant struggle, kind of push-pull in what we do, but also a really interesting piece of it that is kind of relevant in any kind of public safety, law enforcement, kind of any of those fields as well. So that's kind of the high points of Navy psychology and the diversity of opportunities there for a clinical psychologist to go outside of just kind of a therapy room and do lots of interesting, fun things. That was not a recruitment speech for you guys, but if anybody is interested, the Navy is really awesome and has given me lots of really cool experiences. But with that, does anybody have any questions, comments, anything?
Okay, so I have a couple questions.
Sure.
First one is, do you feel like because of the whole military and PTSD, we've been becoming more open about mental health? Like, do you feel like the military has really pushed towards being more open about, because PTSD is like something that everyone's connecting to war and connecting to military, but it's also one of the first things that I hear about when people think about mental health.
So I would certainly hope so, and I think some of the research would support that as well. I think culturally and societally we are in general getting just more open, like apart from the military piece. I think we're moving in a positive direction with stigma and openness with mental health, and certainly I think we have your guys' generation to thank for just being more comfortable with that stuff. But I do think, especially if you're looking at the 80s, 90s, and then going into the 2 decades of war that we just got out of, people can connect with mental health that makes sense, right? And PTSD makes sense. We put somebody in a terrible, awful situation and they developed a problem, right? And we can sympathize with that. And we, at the heart of everything, we're a very patriotic country. And so no matter what side of politics you're on, I think majority of people support service members, right? And so that's something that people could connect with and they want to support, and has started that conversation, I think, in a safe way where, okay, we can talk about service members who've been traumatized, and then maybe it's okay for me to talk about being depressed for no real reason that makes sense to you, but it's still okay, right?
Yeah.
So I definitely think there's 2 streams happening. I think without the military, we'd still be headed in the right direction, but I certainly think that that's helped.
And then my other question is, as far as like background testing before you allow someone to get into military, is there a test that tests your mental health before allowing to, put them into?
Yeah, so that's a really contentious issue in the military, and one they have very, very much pushed for that is probably overly lofty kind of aspiration at this point. At this point, all they do is they give somebody an ASVAB, which is the current version of that alpha test that we talked about, right? So it's just a general kind of intelligence cutoff, like very low. You don't have to be that smart to get in. And then different specialties have different cutoffs, obviously, for the ASVAB. And then they rely entirely on self-report of whether or not you've ever been treated for anything mental health related. And that in and of itself is an issue because of recruiters needing to meet quotas and telling people not to tell them about treatment they've had. So we get a lot of folks who have pre-existing conditions. That's a small percentage though. A lot of it is just we have folks who are not well put together to begin with, who have not as of yet had issues, but the military is kind of the thing that pushes them over the edge, right? So there's a lot of push on the non-medical side to like, how can we identify these people and just keep them from ever joining? And I think that's pretty complicated, right? I think we could do a better job at least weeding out the ones we know are going to have issues. But we're also talking about primarily a population that's between 18 and 30, right? And that's when you're going to see a lot of mental illness come out.
A lot of it has to do with their age, like since so many people.
Yeah, it's representative of the population. A lot of these people are probably going to end up with issues regardless of if they join. And that also kind of feeds into the disability system of, did the military cause these issues, so should they be compensating these people forever, or was this going to happen kind of regardless? Mm-hmm. I've seen a ton of first psychotic breaks, first kind of manic episodes for bipolar, right? Things that were going to happen regardless, but the military was just that stress that kind of tipped the scales, right? So it's very complicated. I think at some point they'll probably do a better job of trying to assess for some of that, but we're only going to be able to do so much. And probably if we can at least keep the folks out who we know are going to have issues because of their history.
Yeah.
The problem is every time we start a war, they lower the recruiting standards, right, and they let a lot more of those folks in. So we are still dealing with a lot of what came in after 2001. So. Yeah.
As far as like domestic violence and suicide rates in the military, does there seem to be like a common similarity between what's going on in their minds that I guess anybody's seen a correlation to?
So I think what we're seeing, again, because we are a representative kind of sample of the United States population, and then you're adding on a lot of extra kind of unique stressors. What I think we're seeing is kind of this perfect storm of family stress, work stress, substance abuse, and then kind of all the depression and suicidality kind of thrown in. It's just creating a big mess. And I don't think they've been able to at this point to successfully kind of tease any of that apart. So I don't think that answers your question, but it's just a big mess. It's a big, complicated mess, mental health in the military, and lots of folks are working on, and especially with the suicide issue, trying to figure out, and there's been so many efforts put into it, and it's just continuing to increase, and they don't know why, right? And so there's just a lot of factors that we obviously have not identified yet that are driving what's going on. But I will tell you, even just from my experience, right, I am well educated, make a lot of money, have a stable family, and the military is still stressful, right? So then you take these individuals who are low ranking, not making a lot of money, don't have a lot of education, don't have stable support systems, have a lot of conflict at home with a spouse or other family members, or they're isolated and they're not near anybody, right? You just add that on to probably, which again, a lot of them already have probably a pretty low baseline stress tolerance. The military is a magnet for individuals who already come from really kind of rough beginnings, because it is a good opportunity for a lot of individuals. So whether they're coming out of poverty or a horrible kind of child experience, right? We see a lot of individuals who come in with child abuse, growing up in kind of really dysfunctional families, already kind of around substance issues or already themselves having substance issues before they came in, right? So again, that's just laying a foundation for the military to then be the thing that breaks them. So
How much do you think it has to do with the like after effects of like when they're veterans and the messed up VA system?
And that's another problem, is there's a huge disconnect between the active duty side and the kind of veteran side, right? There's not a great transition from active duty medical care to VA medical. It's very easy for people to get lost, and I firmly believe the VA is trying as hard as it can, but there's just so many issues that bog down the system, and people get lost, kind of slip through the cracks. It's just a hugely complicated issue that lots of people are trying to look at, but we have not cracked the secret yet of kind of what exactly is going on, and it's very kind of multifaceted. So it's challenging work, but it's rewarding, and you get to do a lot of cool things.
What's the most, I don't know, the best thing you've done, like that's made you feel the most rewarded for doing it so far in your career?
So I think just, you can get really kind of burned out on patient care, just kind of churning through patients, but for me, if I can stay focused on the person in front of me and kind of making some sort of positive impact on them, right? And sometimes we have a very short amount of time with somebody before they transfer or deploy or they do something. Sometimes we end up seeing them for a long time. But if you can focus on just the fact that you helped somebody be successful, you made a change, kind of turned the trajectory of their life in some way, those times when I do get to see them through completion and they actually get better, and they terminate treatment, not because they just left, but they actually are finished, that's incredibly rewarding and can help you kind of keep going through the burnout. And then on the flip side, anytime I get to interact with the non-patient population of the military, so the functional, motivated, excited side, so not the people who are trying to get out or not the people who are just very unwell, but those service members who are just like kicking ass at their job and they love it and they are proud of it, that's really rewarding too, because you get to see kind of how amazing our service members are and the kind of cool, awesome things they do every day. So. Anything else? All right, well, thank you very much for having me.
Thank you so much.